This is the Justiciefighter Podcast. Justiciefighter Podcast. With attorney Gerald Griggs. Attorney G. Where we have conversations on social justice, civil rights, and political news that affects us all. Let attorney Griggs put you on game. Only on the Justiciefighter Podcast, y'all.
What's going on, guys? It's Attorney Gerald Griggs of Justiciefighter, and we're here live on the Justiciefighter Podcast here on the Justice Media Network. And I'm just super excited about our guest today, as she's going to bring some insight into everything that's happening around healthcare policy in the state of Georgia and kind of give us a full understanding of the disparities that currently exist in Georgia around healthcare. So without further ado, I want to introduce Laura Harker. She's a senior health analyst with the Georgia Budget and Policy Institute, and she is going to break it down for us in understandable language about what's going on here in Georgia. So how are you doing today, Laura?
I'm doing well. How are you? Thanks for having me.
I'm doing pretty good. I'm super excited to have you because, you know, with everything that's going on in Georgia, especially with what happened yesterday, I think that my listeners want to kind of get a understanding about healthcare policy in the state and the inequities that we are seeing unmasked in real time around COVID-19, but also around other issues that are currently plaguing underserved communities. So we just kind of want you to introduce yourself, talk about the work that you've been doing, and then I have a few questions.
Sure. I can just tell you a little bit about my work and how it's intersecting right now with COVID-19. I think right now we're seeing how important having strong healthcare systems and public health is for everything related to your economic health, your well-being, your neighborhood's well-being. So everything is interconnected with health and wellness, and I think we're seeing that even more now. But my background is doing a lot of research in public health. My background is in health policy as far as my master's and undergrad degrees in public health. And really I've focused a lot on health equity as far as just trying to understand the ways that health outcomes affect different communities and what to actually do about that. And I think policy is one of those key tools to address those injustices. I think that there's a lot of factors that play into why health disparities exist, and we're seeing those even more during the COVID-19 pandemic, from income inequality to people of color being more represented in low-wage positions that are more public-facing and more at risk of being exposed to the virus. So you're seeing a lot of these issues play out and come in the data, seeing Black communities especially being hurt more by this virus. But my background is also focused a lot on increasing access to health coverage. Georgia is one of the states that didn't expand Medicaid, and so we've done a lot of work as an organization with several other groups to try to get the state to pursue that option so that we're not the third lowest rate of uninsured as we are now, or third highest, rate of uninsured amongst other states. So that's a big issue as well. Chronic disease is a big issue in Georgia, prevention of those chronic illnesses, and also maternal mortality. So those are some of the top health issues that we focus on, but really we focus on our lens as people who aren't making a lot of money in the state, who don't have insurance, who aren't being served by the system as they should be right now.
Exactly. And we thank you for the work that you're doing. And so kind of to start the questions, a lot of people are hearing a lot about, wealth inequality and healthcare inequality, but could you kind of talk about the numbers of uninsured or underinsured in Georgia?
Yeah, there's currently about 1.4 million uninsured Georgians, and that's about 13.5%, which puts us at the third highest rate of uninsured amongst all of the states. I think Texas and another state are right there with us, and that's largely because of the state's decision not to extend coverage to more adults in our state who currently can't get Medicaid for the most part. If you're an adult in Georgia and you don't have any dependent children, there's no way you can get Medicaid in Georgia. You're not eligible. No matter if you make $0, you still can't get the coverage. And for adults with children, you have to make less than about $7,000 in a year. So it's pretty restrictive for adults. We do a great job of covering kids. We have a pretty low uninsured rate for kids, even though that's starting to creep back up. But we definitely see a lot of challenges for people in just not being able to afford healthcare. And also, of course, provider accessibility is an issue, but it kind of plays hand in hand. You have to make sure that payment is there for providers, through insurance, to make sure that they're actually sustainable, the healthcare system is sustainable.
And can you kind of talk about why there's such a disparity in coverage for adults? I know you said that we didn't expand Medicaid coverage, but is there a political reason or a policy reason why they don't seem to be covering adults the way they're covering children?
Well, I think just originally with Medicaid, that was created in 1965 as part of the New Deal, and the original policy goals were really focused on children and kids and pregnant women and people with disabilities, so-called populations that are deemed more worthy or vulnerable because they're more vulnerable in their view. And adults were kind of seen as, well, they should have a job, they should be working, and therefore they should get health insurance through their job. But we know that that's not the case. A lot of adults don't get health insurance through their job, or if they do, they may decide not to take it up because it's too expensive for them if they're in a job that doesn't pay a lot. Taking on health insurance could be several $100s more a month out of their check. So I think in reality, seeing that just this whole attitude that adults should be working and they should get health insurance through their job is not the reality that people are facing.
Okay. And that kind of consideration, considering the number of individuals who are uninsured in Georgia because of what you just spoke about, how is that playing out with the response to COVID-19? You know, people not having access to quality health care, and then, of course, not having access to health care in a pandemic. How is that playing out? How are we seeing that playing out with COVID?
Yeah, I think we're starting to see, as far as just the numbers of people that are needing hospitalization and treatment, the average cost of COVID treatment can be over $15,000. There's different estimates, but just looking at who's able to afford that. Obviously, if you don't have insurance, that's not affordable. Even for people in the middle class, it's not affordable if you don't have insurance. But I think we're starting to see the need for reimbursing hospitals for these services to make sure that they're able to continue to provide care. And also you can see that, so I haven't heard as many stories yet, but we're starting to hear some stories of just people who are uninsured, who aren't sure if they can get a test covered. If they can afford that, they may not seek out that service, or they may not seek out treatment because they don't have insurance and they are worried about facing a medical bill or medical debt as a result. So it can also delay care as well.
Definitely. And we're hearing a lot from the rural counties about hospital closures because of the lack of funding. How does that play out?
Yeah, I think that one of the issues we talk about a lot with health insurance is just how hospitals are having to care for these patients, whether they have insurance or not. And so that's a lost income for those hospitals. And we've definitely seen that have a big impact on the rural hospitals. At least 7 of those hospitals have closed in rural counties since 2010. So, and then there's several others that are just on the edge as far as just financially struggling to keep up with not just uninsured patients. That's a big part of it, the uncompensated care. But there's also the aging population decline, people leaving with the brain drain and going to cities. So there's a lot of factors that are affecting rural communities that are making it harder for those rural hospitals to be sustainable. But we know that one big way to help them is to make sure that they're reimbursed for their care. So that's where Medicaid and other coverage options are really important.
And are there any resources currently available for individuals who may be underinsured or not insured at all to, get some type of hospital care or some type of medical care in the middle of this pandemic?
So there are some federal options that are being considered to help hospitals take on patients who are uninsured, but it may not be adequate, or just may be an uncertainty for hospitals as far as whether they qualify for that funding. So with the federal package, the second federal bill, there's been 3 federal coronavirus relief packages. The second one was the Families First Coronavirus Prevention Act. I think I got that right. There's a lot of acronyms. But that one had a provision that states could use their Medicaid program to pay for testing only for people who are uninsured. So that was a big step to at least get testing covered, but it didn't cover treatment. So for folks who are uninsured in the third bill, the CARES Act that the federal government passed that included the stimulus checks and the unemployment insurance changes. That one set aside $100 billion in money for hospitals, so they can apply for that money to help them cover costs that they're not able to recoup from covering for the uninsured patients that they're seeing. They can also use that money for PPE, for personal protective equipment, ventilators, other needs that they have in this moment. So it's a pretty broad fund, and they have to apply for that money, and it's not really upfront like it would be, or at least not as quick and certain that they're going to get reimbursed for that as it would be with insurance. So I think that there's still a need for the state to step in and make sure that we're taking advantage of all of the federal money that's available. Since with Medicaid expansion and with Medicaid in general, the federal government pays for the vast majority. So it's a way for the state to get a lot more federal dollars in, which we're going to need, especially as we're looking at a shortfall in the budget and soon as a result of this pandemic. So I think that's another consideration is how can we draw all those federal dollars to make sure those that are uninsured and underinsured can actually get coverage for treatment.
Definitely. And so I know a lot of my listeners want more of a forward-looking, how do we improve? And so kind of looking into the future, into the policy goals, how can we best help Georgia move forward and get our lawmakers and our policymakers to take care of these disparities? What's the plan forward?
Well, we have a few different ideas that we've put forward. We have a People First agenda, People-Powered Prosperity, where we outline 8 solutions that the state can take and also ways for the state to raise $1 billion in new revenue to fund these ideas. So in the health category, expanding coverage, of course, is a big one just because of how many uninsured people we have. So some immediate actions there are just to contact the governor, to continue to encourage him to look at expanding coverage immediately, as well as reaching out to your lawmakers to tell them as soon as they come back into session in the next couple of months, we hope, since session is currently suspended, that as soon as they come back in and look at the budget and have to approve that they include Medicaid expansion as part of the budget, or if they're revisiting legislation to amend current legislation or introduce new legislation to expand coverage. So that's a big piece. I think there's also a lot that can be done as far as increasing revenue generally for health programs. One of the ideas we've been promoting is increasing our tobacco tax. We are the third lowest as far as our rate for cigarette tax, 37 cents a pack. The national average is about $1.81. So we're well below the average. So even just raising us to the national average could net us close or over $400 million. And Medicaid expansion costs about $150 million or so, a net cost each year. So that's one thing, and other health options that could be funded with some of that money. So those are some of the ideas. And we also do a lot of work on unemployment insurance, which we have resources on our website about that, as well as just general budget items and needs in K-12 education and higher education. So we cover a lot of issues, but in the health areas, those are some of our top priorities.
Okay. And you talked about your website. How can people get more information around these issues? Because I think a lot of people are just now fully understanding the disparities in healthcare policy in Georgia, but how can they get more information?
So we have a coronavirus resource page on our website, GBPI.org, Georgia Budget Policy Institute is the acronym, .org, and that's where we have a lot of resources updated as they come out, including updates from the state. We've been a part of some efforts to encourage the state public health agency to publish more demographic data, including race and ethnicity data. And I think that's important for the long-term conversation about health disparities and making sure that we're also targeting resources to communities most in need. As we know, Albany and certain areas, Southwest Georgia in particular, has been the most affected when you look at the map of just the number of cases for the population. And a lot of those counties are majority Black counties. And so we're already seeing some early evidence that it's hurting Black communities more. And so we are working to highlight that and continue to push certain efforts to make sure that Black communities are able to get access to healthcare sooner so that we can address those underlying health conditions are able to access jobs that pay more, so be able to move up the employment ladder and increase income, and also just other strategies to increase income for folks. I've also done some work, a report coming out soon on housing and the importance of housing in health. And we know that's especially important now with all the stay-at-home orders, and some people can't stay at home, or their home is not safe, or it's not of quality standards, or it's crowded, or, all these different conditions that are in the home. So making sure that people have stable housing and healthy housing is also a big part of this pandemic.
And specifically, those tools that you have on the website for coronavirus, do they also provide resources, places where people can go potentially to get referrals for the test, or they can, understand more about the virus? Because, we've done a lot on Justiciefighter Radio to kind of talk about the virus and dispel some of the myths, but I think it's always better to hear it from the professionals in the policy arena, to kind of tell people what's real and what's not.
Yeah, we do have some resources related to where to go to find information on direct needs, like how to apply for unemployment insurance and what's changing there, or health insurance information. But since we don't have a direct consumer base, okay. A lot of it, we don't have a built-in constituency. So some of our more consumer-facing partners have some great resources for health insurance needs. If you're uninsured, our partners at Georgians for a Healthy Future have a great landing page for you if you're looking for options, if you're uninsured or underinsured, for what's available, how to get free testing, how to get signed up for coverage. If you've lost your insurance, for example, you can qualify for coverage through healthcare.gov within a 60-day period after losing that coverage. So there's some different options, but there's also a lot to be done at the policy level to make sure that there are those options there.
And are there any last thoughts that you want to leave the audience? You've provided such wonderful resources and information. Is there any last thoughts that you want to kind of get across about what you do and what the organization does?
Yeah, I think that there's definitely a lot of opportunity for you to get involved at the state level. I know when I first got involved in state policy, it felt a little overwhelming, especially compared to some of the work I did in D.C. But at the state level, your representatives are pretty accessible. They don't get a ton of messages or overwhelmed, so even one or two messages can make a big difference. Emailing them now, since they're not in their offices, can make a difference in sharing your story, and also just asking them to make changes that you need. So I think that's just remember that you have power as an advocate to try to move some of your lawmakers, and that they're accountable to you.
Definitely. And we definitely appreciate you, Laura. And if you could leave people your contact information, if they have any questions, or how they can follow you on social media to stay informed about what's going on here in Georgia around healthcare policy, that would be appreciated.
Yeah, so our organization's Twitter is at GA Budget. I also have a personal Twitter. I don't see as much as our organization account, but I'm at Laura E. Hark, Hark. And that's the main place you can see a lot of our updates in real time.
Well, we really appreciate you taking your time out of your busy schedule to talk with us about healthcare policy, and we appreciate the work that you're doing around advocacy for those that are not as astute on policy goals, but know that they have the need for the underserved communities for around healthcare policy. So I really appreciate you, and thank you for taking time out of your busy schedule.
Thank you.
You have a great day.
To be on and to share.
Thank you.
You too.
This is the Justiciefighter Podcast. Justiciefighter Podcast with attorney Gerald Griggs. Attorney G. Where we have conversations on social justice, civil rights, and political news that affects us all. Let attorney Griggs put you on game. Only on the Justiciefighter Podcast, y'all.